Well, great. Thank you so much. Thank you, everyone, for joining us today. My name is Karen Kerrigan. I'm President and CEO of the Small Business and Entrepreneurship Council. Thank you for joining us for our event, What Do Employers, actually small employers, small businesses, what do they want in healthcare? I'm joined by Joel White, who is the president of the Council for Affordable Health Coverage, along with Deborah Pittarino, who is the founder of the Greenporter Hotel and the Agri Council in Greenport, New York. That is on the Long Island, on the North Fork, right? Is that what they call it? I'm getting that right, Deborah?
Yes.
Just real quickly, look at SBE Council. We're an advocacy, research, and education organization dedicated to protecting small business, promoting entrepreneurship. We have been at this for, nearly 28 years now, working on the range of issues that impact the ecosystem for startups and small business growth. We have more than 100,000 members throughout the country, as well as a whole network of state and local business organizations that we engage with on a range of issues. And healthcare has just been one of these issues, affordable healthcare, that we've worked on since the founding of our organization. And we continue to plug away. Obviously, the cost of health coverage, choice in health coverage have been big issues for small businesses for many years now. Again, at least since I've been at this for more than 28 years. And the issue it really has become more of a pain point, I would say, for small businesses over the last decade, but certainly, during COVID-19 and as we ramp up to recovery, it's just one of those set of issues that is weighing on small business owners along with many other issues. Obviously, there's inflation costs, there are supply chain issues, there's access to labor, the labor shortage, and attracting and keeping quality employees, and healthcare and health coverage all sort of blends in with that. In that, many small businesses, they feel it's important or they have to offer health coverage in order to compete and to retain workers. So. Again, we've worked on a host of reforms over the years. We know this is going to continue to be a big issue in the Congress and in the White House. And we just want to make sure that as Congress and the White House is looking at reform ideas or looking at what they want to do to reform health coverage, that they listen to small businesses, they hear the voice of small business, that we are engaged in this debate, and that and help to strengthen the employer-based system, not undermine it. So with that, Joel, did you want to say something first? And then maybe we could turn it over to Deb, where she can, talk about her experience with health coverage. And then we're going to go to the findings of a new morning consult survey that we have released today.
He's on.
Thank you, Karen, for your leadership on this and for getting us together to talk about this issue and to hear from a real business owner who's out there, in the marketplace and doing good things. And I'm excited also about the results of the poll. They align with some of the polling that we've done. But it's the thing that struck me about this poll is that it's the counter narrative. I think a lot of what we hear from Washington-based elites and maybe folks who conduct surveys of purchasers or other groups is we went straight to the business owners, right, and asked them what they want. And when they came back, they basically said, look, we want to provide benefits to our employees. It's a part of our strategy to attract and retain quality workers, but health costs are going up, in some cases much more than our ability to pay for them. And so we need flexibility and we need financial support in the form of tax credits or other incentives, to help us buy these things. And the last thing we need, and this was what was shocking to me, 72% of employers want to provide and manage this benefit themselves. They don't want the government to come in and do price controls or do a public option or do other kind of strategies to kind of put more restrictions on these small businesses. The small businesses want to do right for their workers and have the flexibility with modern benefit designs to be able to manage these costs. So it's an exciting, I think, survey. I think it's even more exciting to hear from a real owner of a small business, Deb, and I'm so glad that you were able to join us. And just very quickly, I'm sorry, the Council for Affordable Health Coverage, we were started in 2001 to pursue policies that lower healthcare costs for all Americans. And we're still working on that 21 years later. Hopefully we'll have more and more successes as time goes on, because as costs outstrip wages, affordability gets worse. And so this impacts our families, and impacts our national finances, and impacts our businesses, big and small.
Right. So Deb, I think, that this is queued up perfectly for you to, talk about your experience on the ground there, running a hotel and providing coverage and, dealing with all the other set of issues out there. Even pre-COVID, it was difficult, right? Then we have COVID, and now we're in the post-COVID economy, and there's recovery opportunity, but this healthcare issue just continues to be a pain point. So Deb, I'm going to turn it over to you just to, provide your thoughts and your story.
Sure. Well, I founded this company 21 years ago. And it's a real small business. It's truly a small business. I worked on Wall Street for 11 years, then did some investing in real estate. I got married much later in life. My husband was a substitute phys ed teacher, personal trainer, and bartender. So I didn't marry money. I made my own money and worked really hard for that money. So I understand, what it is to struggle and to work hard, and to be overlooked, in the sense that I think that when people inherit money or marry money, or the money falls out of the sky, like it seems to for some people, never has for me, but we work really hard for our money. So I have a very close relationship with my staff, and I really understand their struggle and listen to them and talk to them every day. We sit down every day together and have staff meal, and we talk about their struggles, how they're going to pay their rent and get by day to day. And so I started this company 21 years ago, built it from the ground up, both from an operational perspective, and also did a lot of physical building. And then, people like me, who is our competition? So all the other companies around here, like all the other hotels, are owned by hotel groups. So like, management companies, hotel groups. In Riverhead, we have all the big box hotels. And I feel that we're not treated equitably, in the sense that, for example, for me to be competitive, I have to offer a healthcare plan. And my staff needs this healthcare plan. Just a few weeks ago, my front desk manager ended up in ICU and in the hospital for 3 weeks with a kidney problem. And imagine if she didn't have health insurance, she wouldn't be able to, I don't know if she'd be alive, and she'd never be able to dig herself out from that debt. So for a business like mine, the coverage for each employee, depending on age and sex, ranges from about $750 a month to about $1,300 a month per person. I cover 100% of the healthcare here. It is very difficult for me to do, but when I ran through the numbers to see, what they could contribute at the end of the day, what they would net, I just felt like I couldn't ask them to contribute to the healthcare plan. So some of them were like, "Oh my God, this is so expensive. This can't possibly be possible, I'm going to go online and look at Obamacare. Well, when they went online to look at Obamacare, it was even more expensive if you went through the exchanges. And these are not people making 100 grand a year, you know? So, so I ended up going with something, it's a SHOP plan, which is some sort of it's an acronym. I don't remember what it stands for, but it's like a healthcare plan that supposedly the government will give me some sort of a tax credit at the end of the year. But when you read the fine print, for me to qualify for that tax credit, my staff members can't make more than $25,000 a year. Well, who on earth can live on $25,000 a year, especially in New York? So it just doesn't seem, you know, luckily I have other avenues of revenue, and, you know, and I've been around for a long time and I can weather a lot. But I don't think the average, you know, 30-room inn can afford to pay for that. And how sustainable is this? What about when the plan goes from $750 to $820, and then from $820 to $925, and then becomes $1,500 a month? Like, how am I going to pay for that? How is the next owner here going to pay for that? So I find that, you know, neither party has been able to get this right. And, you know, we spent 8 years with, you know, a pro healthcare friendly government who came up with Obamacare, and look at what we have. And I just don't, and I'm not even speaking from a party perspective, but it hasn't gotten better for us. And I don't know how it will, and what answers do you guys have for, you know, what our struggle is? Because how much longer can we sustain this? You know, I mean, I'm paying between $6,000 and $7,000 a month in healthcare costs. So how is this sustainable?
Mm-hmm. That's right. And Deb, I mean, just one, I mean, I know the other issue that you have is just, I mean, there really aren't any choices either in terms of, I mean, for you, and in terms of finding something that would be more affordable, or and it's just like, it's this or, you know, or nothing. And as you said, yeah, nothing is not an option. One, because you care about your employees and you want them to be healthy. They have to be healthy to do the type of work that they do at your hotel, engaging with the public. And then you want to retain, you know, these people as well, you know, who've been working with you and for you, you know, for all these years. And they do, because you're providing this benefit among with other things in terms of the culture of the organization. So, but the choice issue, you just don't have those choices. Is that right?
Yes. You know, well, this is what the brokers will tell you. Oh no, we have choices. You can do an HMO. Well, an HMO, so rather than $750 a month for the cheapest regular plan, then maybe it's $620, but it doesn't cover hospitalization. So what would have happened to my office manager who landed in the hospital for 3 weeks? You know, at probably $1,000 a day. You know, how would she pay for that? So I am, you know, there really aren't choices. It's not, you know, they can say they're choices, and on paper, yes, they are choices, but they're not choices that accomplish the plan of trying to get the best healthcare we can for our staff, and make sure that if they land in the hospital, that they can actually pay their copay and their deductible.
Yeah. All right, Deb. So what we're going to do, and Joel, we're going to go through some of the survey results that we have, some of the findings, you know, and Deb, I know that it's a lot for you to do this because you're running around crazy, and you might have to just leave, you know, to deal with the next crisis running a hotel, and we're fine with that. But if you want to comment on any of these are great. We're going to go through these really quickly.
Sure.
And of course, you know, Joel is going to help me with these as well. So if we can go to the first slide, you know, what we asked here is, do you provide coverage, or what type of benefits do you provide for your employees? And on the healthcare front, half of small business owners, about 47%, say their business offers health insurance employees. And I would say for businesses that are under 10 employees or less, that number has been pretty consistent, over the past 5 to 10 years, under 50%. If there's more employees, I mean, the percentage goes higher, and the same on the revenue front as well, as we'll see, in this next slide, the first point that I was
Before, Karen, if I can jump in on this
Yeah.
one, because I think there's some context here that we need to think about. So first, and Sloan, if you want to jump back real quick, the first point is that, like, businesses want to provide benefits to their workers to make the workplace a better environment so that they are more productive, right? Like, it's a strategy to, attract and retain workers in the business, right? And you can see vacation and sick days are the two top choices, but this 47% number is consistent with what we see in BLS and census data. So the survey result is very consistent with what we're seeing in the official government statistics. And the flip side to this is also interesting. That is, for very large employers, I mean, Amazon, right? IBM, Verizon, the offer rates for health insurance are 99%. That means that if you work for one of these jumbo employers, almost more than 9 times out of 10, they're going to offer you health insurance. Well, for small businesses, it's less than 5 out of 10. Okay. And the thing is, as Karen said, that's been consistent ever since 2013. This has really been a stagnant market. And it's because, as we'll get to in a minute, costs are outstripping our ability to pay. Again, small businesses don't have the leverage in the marketplace to negotiate discounts, bigger discounts. And so it's just the costs are higher in the market, and the cost sharing is higher in the market, and the ability to kind of offer this is really, scrapes up against what Deb was talking about. And that is, we got tight margins, we got costs, we got to pay payroll and things like that. But the other point I don't want people to miss is that these are very important benefits to offer to employees.
That's right. And if you go to the next slide, and thanks for jumping in, Joel, continue to do that. And you too, Deb, you'll see that, the smallest of small businesses, the tiny ones, between 1 and 10 employees, I mean, obviously, many of them don't have, the resources or the capacity, to provide the whole range or the whole suite of benefits. Obviously, some of them do. And particularly, if you're looking at health insurance, 1 to 10 employees, that it drops down to 33%, versus small businesses in the 11 to 100 employee range side, it goes up to 84%. So, Deb, were you going to say something on that?
Yes. No, I mean, to Joel's point, I have a lot of people who work in the hotel industry actually stay here as clients when they take vacation. And we have one gentleman who is a manager at the St. Regis, which is part of Marriott. So, there's thousands, probably hundreds of thousands of employees. And so I asked him what healthcare plan they had. And he said they had the Oxford plan, and he told me the name of it. It's the Oxford Freedom Plan. And I said, what do you pay for? He said, we don't, they cover, I think almost all of it, like 90% of it. And I said, do you know what it costs them? He said, no, but I can find out. So they pay something like $560 per employee for the same plan that I pay $750 for.
Mm-hmm.
And that's because they have the mass to get that big discount. And I have zero leverage. And if I tell the broker, well, then I'm walking away from this, they're like, okay. Where if I were Marriott with hundreds of thousands of employees, they would certainly go back and try to do something to make it more affordable.
Yeah,
that's right. So, and let me just say this too, that this could continue to persist. This can continue to be an issue in terms of this, this low level of coverage if we don't do something about it, because we're in an economy right now where we lost a lot of businesses, and we're going to be replacing a lot of businesses. Entrepreneurship and the people, new business formation is off the charts, but those businesses are going to be in the same position as our existing businesses.
Mhm.
And in terms of providing coverage for themselves if they're self-employed, but also, to compete for workers in order to scale and to sort of dig out of this economic hole and this economic mess, particularly in some industries that were very hard hit, and in certain parts of the country and in certain urban areas where you had the mass exodus. So again, I'm just putting it into a broader context that this will continue to be a big issue for small business, unless something is done on the affordability front. Joel, were you going to say something or going to
Yeah.
move on?
We just see this difference, right, with the very small employees. These are the coffee shops, the garages, the auto repair, the restaurants. These are really the guys who struggle and who have been hit by COVID the hardest, by the capacity limits and things like that. So Karen, to your point, absolutely spot on. And the other thing I wanted to stress, I don't think we did it at the beginning. I just want to make sure people understand this poll out today was done at the beginning of June 7th through the 17th. And it was a sample of 543 small business owners, okay? And that was defined as a business with fewer than 500 employees. So this was like the actual owners or someone in a decision-making capacity at the business, like that, Deb is the owner there. So these are the real world folks who have been dealing with COVID and deal with these issues on a day-to-day basis.
And 73% of those polled, of that larger number, were very small businesses between 1 and 10 employees, 24% between 11 and 100, and a very small percentage, 3%, between 101 and 500. And that pretty much aligns, sort of with, employers in our economy, is that, most of the employers are really small businesses. So it does, again, sort of match, the demographics, if you will, in terms of the numbers. All right, so if we go to the next slide on, this is just another way of saying that if you're really small, it's hard to provide coverage. If you're a business, owners of small businesses with an annual revenue of 250,000 or more are more likely than those with revenue less than 250,000 to provide, each of the benefits tested. If you look at healthcare, it's 17%.
Mhm.
And I will say that 42% of those that we did survey in our poll have less than 250,000 in revenue, which is very typical, of businesses throughout the country, Main Street businesses. And so again, we sort of line up, with sort of your typical small business in terms of their revenue and their employee size.
Absolutely, yeah.
Okay. So on the next one, Joel, I don't know if you have anything to say about this other than it is what it is,
I mean, the point here is that like the businesses want to provide the benefit, and this just says the opposite side. The employees want the benefit, right? Like we've got offer rates and take up of between the 75, 76% and 100%. For more than half of these surveyed, which says, there's some kind of a subsidy. Deb, I think you said you are doing 100% almost, and that's very valuable to someone who's maybe making $50,000 or even less. To not have to worry about that. Otherwise, what happens is these employees are going into the individual market. Maybe they're getting an Obamacare policy, or they're going to Medicaid, or they're just going without. Right. And so this is a very valuable benefit for workers. That's all this says.
True.
Okay. So on the next screen, we asked them to think about the following possible health insurance benefits, and which do they, as business owners, find most important. Prescription drug coverage. I mean, look at that number, 54%. The remaining relate to costs and level of coverage, choice, issues. You have out-of-pocket costs for employees, 39%, the level of coverage, 38%, choice of providers, 37%, the cost of employee premium, 36%. This issue we see popping up a lot more. I've seen it on surveys and with my members. Mental health coverage, 27%. I mean, that's been, a big issue now in the COVID, economy, and what we hear from employers in terms of some of the concerns that they have, not only as employers themselves, but also with their employees in terms of the toll mentally that COVID has taken on them.
Yeah, to jump in here, I think that, this is not surprising, right? Like if you think about workforce age people, they're typically not Medicare beneficiaries, but they have some prescription drug issues, right? Like they're taking a drug for maybe, GERD, or, maybe for a lung illness, or, heart, blood pressure medicines. Most working age people are generally healthier than most of the population. And they're not going to the hospital generally, and they're not necessarily going to the physician office every month, like many Medicare beneficiaries. They are going to the pharmacy once a month to refill their script. And so that's why I think prescription drug coverage is such a top of mind issue, because so many more people are accessing that part of the benefit.
Right. And, I did see a data, a stat, I think it was a 2015, 2016 report that showed that 45.8% of the US population used prescription drugs in the past 30 days. So it's a significant percentage of the US population that actually accesses prescription drugs, which is obviously why this is important. And we know, affordability plays into that issue as well.
Absolutely.
Okay, next slide. Not surprisingly, half of small business owners say it is very important for business owners to offer health insurance to full-time employees. 75%, very important, somewhat important. Now, we did poll small business owners who provided insurance and those who did not provide insurance. And nearly all small business owners who offer health insurance, 97%, said that it is important to offer health insurance to full-time employees. So, they see the value immediately when they offer insurance in terms of being able to attract, retain, et cetera. I mean, it really has become important to their business operations.
Crucial.
If you look at the next slide, I think that, most small business owners, 62%, say they believe, their full-time employees are satisfied with their health insurance options. That's big, right? That's a big number. And, I think that, what we see from a lot of business strategies now is, regular surveys of employee attitudes towards benefit offerings. Deb, I don't know if you do something like that for your employees, but
we do. I'm actually surprised that it's 32% that are satisfied, very satisfied. And I think that none of them, those people have had to use their insurance, because if you've had to use your insurance, and like I said, I have, Oxford United Healthcare Freedom Plan, which is the best you can get. And the deductible is still quite high. It's like I think it's like $2,500 before, it kicks in. So if you've had to use your benefits, I don't know if you'd be 32% satisfied. Then the second thing is, I know I have friends who have the healthcare coverage for their staff, and they have HMOs, and the staff doesn't really realize that it's an HMO. So when they end up in the hospital with a huge bill, I don't think they'd be 32% satisfied. So, and then, that lines up with the fact that, Americans really aren't going to the doctor as they should for preventative care. I have a friend who's a partner at PwC, PricewaterhouseCoopers, and PricewaterhouseCoopers pays their employees to get a physical every year. They give them money. So if you show up for your physical and you prove it, they give you like a check for $500 or something, just to get them to go for their physical.
You know what, but I will also note that, you know, and Joel, you know this, in all the surveys of employees that get in the private marketplace, just sort of the level of satisfaction has been off the charts, right? In terms of being very satisfied with their health coverage. And in this survey, again, there's that little light blue box that we're looking at, that the business owners who offer health insurance, 89% say their employees are satisfied. So anyway, for those who don't offer insurance, I don't know how they sort of know that if they have their employees have insurance on their own, that they're satisfied. But this just tells me that if employers are offering it, their employees are using it, and that they know that they're satisfied. So, okay. All right, so we're going to the next one. Joel, I don't know if you want to sort of take the first shot at this. To me, this was just, you know, again, it you know, from a small business perspective, is something that we've just been saying for, you know, 10 to 15 years: affordability, flexibility, choice, you know, diverse health insurance options. I mean, these are all just critically important, you know, to small business owners and their employees. And again, that they feel very strongly, these employers, that they and their employees, not the government, should decide which healthcare plan to offer workers.
Yeah, there's a lot to unpack on this slide, and I think that, you know, there's three main points here for takeaways. The first is health coverage is a key strategy to attract and retain employees. 75% of small businesses said that's true. Secondly, they really want to be able to manage the benefit and not have the government kind of get in the way. That's, you know, 72%. And then, you know, getting additional choices and options on the table, like Deb, you said. I mean, you know, you basically have like one option, and it's expensive. And so, you know, if there were more options and lower price points, that would be a lot more beneficial for employers to be able to offer additional options or do more things for their workers. But it's really, you know, this is a key strategy. We see a lot of unfilled jobs, and this would be key in attracting workers and keeping them. Secondly, the employers want to do this. So this is the counter narrative that we're hearing. Employers want to dump. Employers want a public option. Employers want Medicare buy-in because, you know, oh, health costs are too expensive and they don't want to do it anymore. That is not what we're seeing in the survey data. The survey data says, I want to provide this benefit to my workers. It's important. It's important for them and for me to do the right thing. But I've got to have additional flexibility to manage this thing, and I've got to have some help. The other thing that's here is that the additional tax credit or financial incentives to businesses and their workers to help them afford the costs associated with their health coverage.
Right. A real tax credit, and a little bit more less restrictive, right? And that Deb is finding in the SHOP plan, that when you look at that tax credit, and that's been the tax credit problem all along under the Obamacare plan, has been the restrictive nature of it, the complexity of it, and not that many of our members actually used it, because Deb is right. Not for those they're providing health coverage to, they're also providing some pretty decent salaries as well.
Yeah, no, it's very, you know, there's that issue. There's, you know, it's interesting. I was also looking at the other slide, I think 2 slides before this, where it talked about the amount of businesses that offer healthcare coverage for families. Like, there's no way I could pay for healthcare for my employees and their families. I mean, it would just be completely impossible.
Right. That's a good point, Deb. That's a very good point.
So I don't know how that could possibly be. Wouldn't be possible for the average small business.
So the next slide, you know, we sort of listed out, you know, those agree, disagree statements. And then we basically, you know, broke it out by male, female, millennials, Gen Xers, boomers, Democrats, independents, Republican. And you can see there's widespread agreement, you know, on all of these issues, you know, that providing health coverage is critical to attracting and maintaining employees, that employers and employees, not the government, should decide which health plan to offer workers. The whole issue of accessibility, flexibility, affordability, that employers need choice and diverse health insurance options to meet growing employee needs. So it's again, this should not be a political issue. I mean, this should be something that both Democrats, Republicans, and independents work on together, because there's consensus in the small business community, no matter what the political affiliation, whether you're male, female, a boomer, a millennial, or a Gen Xer. So.
Yeah, I think that this choice issue is key. We saw this in the Medicare Advantage and Medicare Part D. Now, for employers, people want choice. They want options,
Yes.
right? Like they don't go to Burger King and just want like, oh, we've got Whoppers and that's it, right? Like they might want a single or, chicken nuggets or something like that. So people like choices, and that means we need another thing in this survey that we didn't highlight, but is that people want transparency. To make choices, they need good information, and they need that information. But the interesting thing here, Karen, is that highlighted thing in the middle. Employers need choice and diverse options. Look at those numbers for Democrats. That's near 90%.
Right.
Right.
Yes.
And really very close to the Republic. I don't know what's going on with the Republicans and the independents, but they're a little less. But very, very aligned across the parties here.
Right. So, yeah, it sort of works. It really does when it comes to single payer or something like that, right? This is not, it would not, obviously, the whole, a choice issue would not work on that front. So, okay, so the next slide, when we asked business owners about what the biggest benefits are of providing health insurance to their employees, number one, maintaining employee health and productivity. Again, they really care, about their employees. I mean, they care about them as family members, but they also know that they're healthy, they're going to be productive, and the business benefits from that. Obviously, the competitiveness issue in terms of retaining employees, reducing employee turnover, attracting employees, gives them a competitive advantage in the job market, improving more employee morale. This is all about the well-being and the experience of the employee at their small business.
Absolutely.
Okay, so next we get to the next slide, talk about the drawbacks. What are the biggest drawbacks? No surprise here, it's high cost of health insurance benefits. Number one, 55%. Again, the second issue, increases in health insurance costs, annual or unpredictable, 39%. Finding group plans designed for small to mid-sized businesses. Deb discussed this, in terms of not really having that choice, or something that is scaled or meets the needs of her small business. Low buying power for small business. Again, Deb spoke to that. Anything else here, Joel, that you wanted to highlight?
Just that, so the next slide, so this one's talking about the decision to actually offer benefits. The next slide talks about the choice when they make a choice in a benefit. It's really about that monthly cost, the premium, and the out-of-pocket costs as the most important factors when choosing a plan.
Yep, there you go. Okay,
Yeah,
so
and,
go ahead, Deb.
and you notice there where it says employee coverage choice, whether it's an HMO or a PPO, because that, it's like, are we covering them so that they get their annual physical and, get their blood pressure checked, or are we covering them if they have something catastrophic, like what happened to our front desk manager, where they land in the hospital for several weeks? And that's when a lot of small business owners, because they're so worried about the bottom line and the cost, the extreme cost of healthcare coverage, might go with an HMO, not really understanding that that's not going to cover someone if they end up hospitalized.
Good point. And on the next slide, again, one of the one of the benefits or the value to providing coverage, to their employees, that when we asked, how much of an impact does your employer provided health insurance have on reducing employee health care costs? 87% say it has a positive impact on reducing employee health care costs. So it really does help, to subsidize and to cover, those costs that would be very, very difficult, for an employee to do on their own. Okay, so the next slide, was it, we asked, do you agree or disagree with each of the following statements? Again, this is all about cost. We asked about cost. The total cost of health insurance benefits for businesses increases year over year. 82%, agree with that statement. So this speaks to just the unpredictable nature, or really not being able to manage those costs, and the need for affordable choices in the marketplace. And then, go ahead, Joe.
The other thing here is that businesses really say that they can manage the costs better than the government can.
Right.
And that's an important point, because again, this narrative that's going that, the employer community is clamoring for the government to get involved by price controls or public option or things like that, just runs counter to what we see in the data.
Yeah.
Well, we've already been down that road. I mean, we had, 2 administrations where, there was, government-sponsored healthcare, and we didn't see any improvement. As a matter of fact, we saw healthcare costs go up. So I think it's already been demonstrated that, despite the goodwill, the government doesn't have the ability to manage healthcare, to manage a healthcare system, at least not in this country. I don't know how I don't know. Do we need advisory from countries that have made it successful?
Well, not that many have, Deb. That's sort of.
Yeah, I know. Well, you know why I say that? Because when my husband had cancer and we were at Memorial Sloan Kettering, supposedly the best cancer hospital in the world, next to us were 2 people from England, and across from us were 2 people that came in from France, and somebody from Saudi Arabia, and somebody from Germany. And, a lot of these countries have public health care, and here they were sitting in New York City at a place where they're going to pay gazillions of dollars for healthcare. So, I'm not really sure.
Yes, and I will note that the last government involvement in healthcare has helped to lower costs and increase choices. 16 strongly agree, somewhat agree. So, business owners don't agree that involvement has helped to lower costs and increase choices, and that was what was promised in the Affordable Care Act and other types of reform efforts over the years. So the next slide really just shows what are the impacts of rising health insurance costs. What has been the impact on businesses like yours? These are all, what you would expect in terms of employees paying higher percentage of health insurance costs, that gets passed on to the employee. Deb has not done that, but there's been changes of insurance policies, and they've had to fiddle around with the types of coverage that is providing, reducing medical benefits, less family coverage for employees. But also there's other impacts to the business in terms of held off hiring, delayed growth opportunities, less competitive in hiring, reduced employee salaries, held off on promotion or raises. So, all these have an impact on the viability, the competitiveness of the firm, which ultimately has an impact on the employee. And anything else on that one, guys?
No, I think, this is very really lines up with my, with our experience here. A lot of my, people that I speak to at the Chamber of Commerce meetings have gone from PPOs to HMOs. And again, I don't really think they realize the ramifications of something like that. but they said that if, they just weren't able to pay for a PPO, so they felt that an HMO was better than nothing.
Mhm.
And it definitely, in my case, I really I prefer to continue to pay for most of the healthcare coverage rather than to, pay more money in wages, because then that increases my payroll costs. I have to pay more payroll taxes. I have to pay more workers' compensation. I have to pay more disability. I'm basically discouraged from, raising wages in order to continue to cover healthcare costs.
All right. Thanks, Deb. So the next slide, Joel, any comments on this one?
Yeah, I mean, this is basically a bit of the bar graph that we saw earlier. The 50% to 37% say they're better, private sector is better to manage healthcare costs and benefits for their employees than the government. Again, runs counter to some of the narrative that we hear from the elites and the inside the Beltway crowd. But I think that there's a dynamic at play beneath this number, and that is, Deb, I think you're in New York State. Some of the most mandated benefits in the country, some of the highest taxes in the country. So they say, well, yes, I'm a business. I think I'm better able to manage these costs. And at the same time, these government policies are tying one hand behind these businesses' backs by being able to tailor benefit packages in ways that, put the most bang for the buck. Not every employee, like single males, might need maternity coverage, right? Or postmenopausal women, or things like that. And we can think about the different types of benefits that could be most important. I think this survey says prescription drugs, right, are the top. But then we might have mandated benefits that might not be as important. So I can manage those costs in the private sector better. But please don't tie one hand behind my back as I'm trying to manage those costs.
Yeah.
Good. Okay, so the next slide, we asked small business owners, which of the following healthcare issues are most important for policymakers to address. Not surprisingly, again, the cost issue, the cost of health insurance premiums, the cost of prescription medicines top the list. The pre-existing conditions, made it in there at 3. That's always been an issue that's popped up. And then we get back to costs again. The cost of hospital services, plan enrollee out-of-pocket costs, and then the limited options for health insurance coverage. And then we get back to cost again, the cost of physician services, unexpected hospital and ambulance bills. But look at these top issues, and it's really, it goes to, again, the cost issue really is the thing that's driving the pain point, with many business owners, as well as many self-employed in their, ability to either, to provide coverage or to get coverage on their own. So anything else, Joel, on this?
No surprises here. It's cost and choice. Give me some options and get my costs down.
Okay. And this next slide, we wanted to ask, outside of, health insurance, again, business owners have a lot of stuff on their minds right now, right? I mean, they're dealing with, again, sort of ramping up in the recovery. They got inflation, labor issue, shortages, they have the high cost of healthcare and a whole range of other issues. And when it comes to healthcare, there's other issues that really are on the minds of small business owners that I think they're not thinking that Washington or policymakers are paying attention to, but certainly are on their mind. And so we asked them, what are some of the other critical issues that that policymakers need to address? And not surprisingly, preparing for COVID-19 variants or the next global outbreak, topped the list. I mean, they were on the front lines of the impact of that in terms of having to close their doors, revenues, going through the floor, and all the other disruptions to their business, dealing with addiction to opioids and paying prescription painkillers still is a big issue. I mean, I haven't really heard that being talked about that much over the last few months. But it continues to be a big issue for many small businesses, and perhaps, COVID-19, fueled, some of these addictions as well. And then racial disparities. They're still concerned about COVID-related government mandates that restrict businesses. I think maybe, moving forward, or any other types of regulatory things that were put in place at the state or the federal level, that are impacting their businesses. Joel, any other thoughts on this?
No, I think, you covered it nicely.
Okay, couple more slides, and then are we going to do some questions?
Yeah, I think we'll have time.
All right. Hey, Joel, do you have any thoughts on this very, very colorful slide we have, Joel?
This is all about, it was a very open-ended question, I think. And it said, if Congress and the administration did policies that would give government a greater role in health coverage in the healthcare system, do you agree, or, these following outcomes would happen? And, I think that, look at this, 72% said my taxes are going to go up. 2/3 said my employee taxes are going to go up, and the cost of my coverage for my employees are going to go up. So again, I think there's often, like, politicians in Washington say, well, let's have this public option. It'll be wonderful, and there's no downside whatsoever, right? And I think business owners go, oh, all these free benefits just fall out of the sky. No, they come from our payroll taxes. They come from our corporate taxes. They come from our employees' wages. They come out of their pocketbooks in form of their payroll taxes. So they're kind of savvy, and they kind of see through what the politicians don't say. And that is, my taxes are going up, my employee taxes are going to go up, and the cost of my coverage is going to go up. So there's other interesting things in this long list here, but these are pretty strong numbers. And again, runs counter to some of the narrative that we hear about. There's only wine and roses and no downside to some of these policies.
Mm-hmm. And then the next slide.
This is all about being transparent.
Yes,
kind of what we said.
Mm-hmm. That's right. And we just went through a list of issues in terms of some of the policies that, may be addressed in Washington by the Congress and the president, and, sort of a favor or oppose a policy. And you're right, the transparency issue comes out very strong on this. And then there's, a laundry list of other issues on here as well, including the tax credits and the financial incentives to help individuals or the self-employed cover the cost of health coverage, financial incentives for businesses, and real tax credits, right, Deb? For businesses to provide a coverage. And then improvements of some of the current plans that are offered, particularly or some of the current options, particularly with health savings accounts, because more and more businesses are offering HSAs, and there are a vast number of ways that HSAs can be improved, make them more practical for employers as well as employees. So
the one thing
yes.
that I would kind of highlight is that there's majorities against price controls, and this allowing the government to kind of negotiate the prices, and so I think that's important as well. And the other thing I would say is that, see that bottom bar, that's about reversing purchasing pools for small businesses and some of the other choices and options that were implemented during the Trump administration. And there's a 29% don't know. And I think there's an opportunity to do more education around what is a purchasing pool? How do we get involved in something like that so that we have the same purchasing power as the big the Jeff Bezos of the world. We get a better price on our coverage by joining other small businesses in getting our health coverage and maybe getting a better discount on the price of the coverage.
I have some firsthand knowledge with that. So I'm the treasurer of our Chamber of Commerce here. And we all talked about, let's talk to some healthcare brokers and see if we can get a trade organization sort of umbrella plan. And so I, spoke to our broker and they said, well, how many people would be participating? I said, probably 70. And they said, no, it's just not big enough. So it has to be hundreds for them to even talk to you. So again, to be able to get there. And I said, well, what if I could get 100? And that wasn't enough either. So I don't know if they mean they need 500 people. I don't know. I was so frustrated that I gave up at that point. But that's like a pipe dream, from my experience.
Yeah. And there's a lot of innovation going on or has been attempted in this space over the years, sort of, using like health tech, like fintech and I just continue to think these potential competitors or new ways of doing things, they just continue to run up against regulatory barriers. I mean, not only at the federal level, but certainly at the state level as well. I mean, in order to have a national marketplace, if you will, for coverage, it can be done, but there's a lot that needs to be done to sort of, break down the old regulatory order, if you will. Not saying there should be a safety net or regulations, but there's just so much old stuff in there, and so much regulatory garbage that it makes it very difficult, for these innovators, I think, to make that a reality. Okay, so last slide, we just simply focused on tax credits. We asked, would your business or the business where you work utilize tax credits or financial incentives to help cover the cost of health insurance for employees? 71% said they would. Actually, of the small business owners who offer health insurance, 86% said they would be more than likely to use these types of incentives. So, we think there's space here for Congress and the White House to think about this, as opposed to mandating more things or trying to take over the whole system to help, strengthen private coverage and hopefully drive more choice and affordability in the system. Anything else on that, Joel, that you
Yeah,
have?
so CHC, my group, has a policy approach to this. We've designed a couple of tax credits to help small businesses who offer coverage better afford that, and then help small businesses who don't have coverage to start a policy, and then also to help reduce the employee out of cost through a separate tax credit. And look, 71%, 7 out of 10 people, business owners say, they would use this. And in our poll that we did back in March of swing state voters, we had like 78% support, and that was higher on the Democrat side than it was on the Republican side. So, this is good retail politics, but it's also good policy and smart because, the offer rates are below 50%. The costs are more than the large businesses pay. And but it's a benefit that small business owners want to provide. And they would take this tax credit and use it to continue to offer good private coverage versus the alternative, which is, more uninsured, or more people on Medicaid maybe, or more people on Obamacare where they're paying $4,000 deductibles. So it's like, this is kind of like one of those no-brainers that we see in the policy and political world, right? You get it's more than 70% of anyone saying this is a good idea. You kind of win that battle, at the retail political side, but then on the policy side, this is just so consistent with where people want to be, right? Like, I like job-based coverage and I want to offer it. It's just a win-win-win.
Right. Deb, as we close out, which we're going to, because we're a little after 4 o'clock, so we're going to wrap up real quickly. Joel, did we get any questions? Or I know we'll probably, we'll follow up with folks if they came in online.
I
but-
don't see any.
Okay, all right, good. But I will let folks know that we'll have these slides online. We'll have all this information online, and that, SBE Council, and I guess I could speak for you as well, Joel, that, we're going to continue to, elevate our voice on this issue. Small businesses are facing so much right now in this challenging economy. There's a lot of uncertainties, and government can be helpful in relieving some of their pain points by some very simple things. And for the federal government now to be taking over the entire healthcare system again, possibly, along with all the other things it wants to do on infrastructure, and the list goes on and on. We just think there's, simple, more common sense solutions, and that Democrats, independents, Republicans, small business owners, agree with where we're coming from, on this issue. So, Joel, anything else for you to, let me turn to Deb. Anything else you want to say, Deb, again?
No, I think, I look forward to, seeing, any help come to fruition, any, real help, because like I said, I signed up for the SHOP plan supposedly for tax credits, and it seems clear from reading the small print that we're not going to qualify for the tax credits. So, what kind of relief will we get, and how will we be able to offer, fully sponsored healthcare moving forward? I'm not really sure how that's going to happen, but I look forward to, whatever plans there are in the future.
Thank you so much, Deb, for joining us.
Thank
I know
you.
you're really busy.
Nice to meet you guys. I really am going to take off. Okay.
Check it out, folks. Green Porter Hotel.
Yes, Green Porter Hotel. We're on the North Fork in the middle of Long Island wine country, over 60 wineries.
And lavender farms and all the rest.
Lavender farms and great
beautiful
cycling, and you'll be close to nature and beaches. Okay. See you soon.
Thanks, Deb.
Bye.
And Joel, anything else, Joel, that you wanted to add?
Just thank you, Karen. Thank you for the survey and the webinar today. And Deb, I'll be making my reservation soon.
Excellent. Bye. Thank you.
All right. Thank you, everyone.
Thanks,
Thanks.
Thanks, Karen.
All right, bye-bye.
Bye.